Hi, my name is Julie Marthaler, and this is my presentation for the ISC 450 course project. I chose to demonstrate the order CPOE workflow for my project, and that workflow is made up of 8 processes: communicate order, review patient data, select drug, select dose, consider formulary, sign order, use order set, and reconcile meds. And to show you the order workflow used in my EHR system interface, which is what you see here, I will take you through the steps of ordering a medication in the emergency room of a hospital. Eileen is a patient in the emergency room. She is in severe pain from an advanced tooth infection, so Dr. James, who is the attending physician, orders 5 milligrams of morphine IM. And Daniel is the unit clerk. He starts the order process for Dr. James by looking up Eileen's record through the patient list query. And that is part of the first process, which is communicate order. And we're still on the communicate order process. So Daniel is in Eileen's record. You can see on the left that we have all of her information except for her full patient profile, which is something that you wouldn't necessarily have to see at all points whenever you're in her record ordering anything. So Daniel clicks on the medication order icon. That will take him to the medication order screen. And we're still on the communication order process. So Daniel enters the drug order screen and clicks on IM choices, which is what you see highlighted here, and that can be selected from a drop-down menu of route choices. And part of the review patient data involves the system looking at Eileen's age and allergies, being aware of that, and then giving options for the user to choose drugs in IM form that are compatible with the patient. And the system would warn if there were any drug interactions. And the next process is select drug. So Daniel chooses morphine, which the system gives as a drug option based on Eileen's chief complaint, which is tooth pain. And the select dose process involves Daniel selecting 5 milligrams out of the choices for 5 milligrams, 10 milligrams, or 15 milligrams. And part of consider formulary is the system allowing for one-time only doses, which is what you see here. Multiple orders can be placed for the morphine if needed, but with this one particular order, you can see that it's a one-time dose. And the frequency is not allowed as a field. Part of the sign order process is Daniel clicking submit to send the med order to the pharmacy and to update Eileen's record. And another part of the sign order process is Dr. James has to sign the order, as all orders for drugs must be checked and signed by the attending physician before it can be sent to the pharmacy database. And the next process is to use an order set, and if you click on other orders, you'll see that there are specific order sets available to the user, and that is based on Eileen's complaint of tooth infection or tooth pain, which can lead to death if untreated. So there's an order set that gives standard orders for x-rays, further medications such as antibiotics, IV fluids, and lab work. And the final process is to reconcile meds. And when patients are discharged through the system, they are given a discharge summary and a report of the following, which are previous drugs and doses given at the hospital, prescriptions to be filled at the pharmacy and taken home, or taken at home, any outpatient appointments, and discharge instructions. So that concludes my presentation on the order workflow. Thank you.